I've watched families get blindsided by more times than I like to even admit when it comes to long-term care health expenses. So if a parent or yourself needs full-time custodial care, people assume that Medicare will cover that, but that's not the case. So I want you to understand what Medicare does not cover or what Medicare does cover to avoid those massive surprise bills that can come in when it comes to long-term care. Again, let's help you be prepared to know what's right and best for you. I'm Emily, and today I'm going to walk through the things to think about as to what Medicare does cover or does not cover when it comes to long-term care and what your options are. Here's what most people don't know, and that is Medicare will cover short-term nursing facilities after a hospital stay, but only under very specific conditions and only for a limited amount of time. So if you don't know how long-term care works with your Medicare coverage, it can lead to a lot of surprises. So in this video, I want to walk through how do the rules work, what you should be aware of to avoid burning through your retirement money on unnecessary or uncovered expenses. I'm Emily with the Medicare Coach, and after helping over 100,000 people, there's a theme that I continue to see every single time when it comes to long-term care, and that is there's a lot of confusion around it. Now, Medicare will cover some skilled nursing care, but only if you had a 3-day inpatient hospital stay. So I want to start with this 3-day hospital stay because it's so incredibly important. Now, my aunt had a hip replacement, and she was in the hospital for a couple days, for 3 days, really 2.5 days initially, and she wanted to leave the hospital, which I completely understand. But the thing is, my aunt had to have a bandage replaced on her hip every couple hours. Now, in order for Medicare to cover that nurse to come to her, in her house in this case, to have the bandage replaced, she had to be classified as an inpatient patient for at least 3 full calendar days. So while she desperately wanted to leave after 2.5 days, I said, you have to stay for just a little bit longer. And by staying for a little bit longer, you will then qualify for that 3 days that Medicare will cover all your expenses, at least to take care of the bandage on your hip. So my point is this, had she left at 2.5 days like many people do, she would have completely waived her option to have Medicare paid for some skilled nursing care. I had a woman come to me the other day whose husband was in the hospital, and they I don't know why, but the hospital would put him in inpatient and then observation and then inpatient and observation. So he never actually hit his full 3 days of inpatient care, which means that Medicare would not cover any skilled nursing for him. So if you or a loved one is ever in the hospital, if you want to have Medicare help pay for some skilled nursing care, you have to have a 3-day hospital stay. Now, what will Medicare pay for? Again, Medicare will cover the medically necessary services. In my aunt's case, it was the bandage on her hip to have replaced. Now, if your loved one goes into the hospital for, say, Parkinson's or something of that nature, Medicare will not usually cover that because that's not usually medically necessary care. So where long-term care comes into play is for that custodial care. If your loved one again has Parkinson's or anything else that requires them to be supervised, to be fed and bathed, things like that, Medicare will not cover those things. Now, Medicaid, not Medicare, Medicaid might cover those things, but you don't usually want to be in a Medicaid facility, but it is an option if you have no other alternatives out there. My point is this. If you are worried about that custodial care as you or your loved one age, it might be worth thinking about long-term care. Now, I'm not technically recommending long-term care, as I believe it's a very important part of your overall financial plan, and it's important to talk to your financial planner about these decisions. But there are some plans like life insurance plans that have some sort of long-term care option on top of them. There are other things out there, but long-term care is quite expensive, and so this is not an endorsement for long-term care, but rather an education to remind you that Medicare does not cover your long-term care services. And this oftentimes surprises people. So if you need to have skilled nursing care that is medically necessary, yes, Medicare can pay it with that 3-day hospital stay. And again, fight with the hospital to not not have them dismiss you until you meet that criteria if you need that skilled nursing care. But other than that, that long-term care services are covered separately from Medicare. So make sure you follow along for more inside tips to help you easily make your right Medicare decision.